Hello, everyone, and good morning. It's such a pleasure to be here. And I just want to thank Lisa and her team here at Defeat Duchenne Canada for inviting us here today, especially on my favorite topic on patient advocacy engagement, because I'm extremely passionate about that. I'm going to try to go really quickly because I know the person who you really want to talk to is my colleague here, John, on what we do with patient engagement and advocacy. So my name is Amy Grover. I lead the advocacy efforts for Catalyst Pharmaceuticals. Catalyst Pharmaceuticals is a US-based company. We are a commercial stage company, and we took over the rights to Vamorlo, AKA Agamree, last year. We were approved in October of 2023, and we launched in April of this year. So we've been very busy. Here's our team. So we have a close-knit team of 3 people. We work very hard. We work across actually 5 disease states. So we're incredibly busy. And I'm going to say that I'm passionate about the Duchenne community. I actually come from the nonprofit space. I started or helped start a nonprofit there in the United States called Global Genes. I was there for 10 years, and I was very entrenched in the Duchenne muscular dystrophy space. So I feel like I'm coming back home. So Catalyst's 4 pillars of patient advocacy is really support, educate, engage, and empower. And I think it surprises a lot of people how closely the pharmaceutical companies do work with the patient community and with patient groups. And we're there to be another spoke in the wheel. And we truly try to be that, that entity, that partner with the patient community and the patient groups. And so we listen to the community quite closely. And we have patient advisory committees. We talk to patients and families and parents just so we can walk the talk and be there, kind of walking with you. We educate, we offer resources through our programs to help patients and families make informed decisions beyond treatment. And so we offer a lot of tools and resources, and we engage. We enable patients and caregivers to share their stories and promote awareness. So we want to be able to empower patients through those stories to take an active role in their healthcare outcomes. And in my past, I worked with hundreds of patient advocacy organizations and talked to thousands of patients. So I can take that experience and help kind of the newcomers and the newly engaged into the patient advocacy space. And so here are some of the programs that we offer. We work with, like I said, 5 disease states, everything from epilepsy, which is 1 in 26 Americans, so it's a huge space, all the way to Lambert-Eaton myasthenic syndrome that only has about 3,000 patients, and they are just now getting their advocacy efforts started in the United States. So we fill that role. Until they can get up and going, we will fill that role. We will help them out, and we will offer educational tools and resources. So you can see some of those up here. We have a podcast. We have 2 actually going. So we love to kind of get there and educate. We have patient videos. We have written stories, webinars. Of course, we're out at events. We bring the patient community in and give them the opportunity to share their stories, whether it is in webinars, whether it is in the podcast, patient videos, and it really does empower them. We were at an event, and I'll go quickly, last year where it was just a young woman. Oh, she's fantastic. We met her. She's fabulous. We brought her in as an ambassador, and now she's going out and speaking at events. And she said, I would never have done that have you not pulled me into your booth and said, hey, you have this opportunity to do that. So she's absolutely wonderful. And we have collaborations. So we try to join as many collaborative efforts as possible. We work really closely with our patient groups to develop tools and resources and programs. It's really about partnership. And Lisa and I've had a conversation yesterday. She's fantastic about working together with her industry partners to really move the needle forward, because it does take a village to be able to do that. And then there's some of the quotes there. And then, of course, Duchenne Awareness Day. So we jumped in there. Part of our job is to educate all of our employees on the patient community. We are that conduit between the company and the patient community. So we brought everyone together. You can see my family up there on the top in the middle with our puppies, and just really try to bring the entire company in, and so they know exactly why they come to work every day. And then here are some of the pictures of our, our group. We're out and about all the time. This top picture up here is one of our wonderful ambassadors. She comes out to events with me. And it's lovely to be there because I can only talk so much, but when you're living it every day, she's able to talk to the attendees at these events so much better than I could. I step back and I just let her go. In fact, her husband is a caregiver ambassador as well, and so he does such a great job. So these are just a few of the pictures of our team out and about there. And so Catalyst Pharmaceuticals, again, I say is a small company, but I'm going to turn it over to John from Kye Pharmaceuticals because you're going to want to hear from him and our partnership, and I'll let him explain that a little bit more.
Thanks, Amy. Good morning, everyone. Go to the next slide. Maybe is there another slide? I don't know if there is. By way of introduction today, to have just a couple of slides really to introduce Kye Pharmaceuticals to the room. And we're new to Duchenne in Canada. We look forward to the journey with all of you. And actually having Amy present and their involvement already with Duchenne through their earlier work in the US is a great segue. And our partnership with Catalyst is a terrific example of both companies working really well in the best interest of getting as many medicines to as many physicians in as many countries as possible. So Kye Pharmaceuticals is only 4 or 5 years old in Canada. We set this company up to look around the world and identify novel prescription medicines that were not otherwise being made available in Canada. And could we approach those organizations and find a way to bring them here and make them accessible? As you saw from the presentations yesterday, Dr. McMillan and others highlighting a lot of therapies that are available in the US that are not yet available here. And certainly the same goes for Europe versus Canada. And it's not exclusive to Duchenne muscular dystrophy. We see this across many areas of medicine. On the slide, just by way of example, I've shared with you some of the medicines that in our first few years we've successfully been able to secure and bring to Canadian patients. And there's a heavy weighting in this area in neuroscience, both neuromuscular and psychiatry. I've left the other medicines in our portfolio out for the sake of today's audience. But you can see on the right-hand side of the slide, our previous partnership in neuromuscular with Catalyst and our partnership in bringing amifampridine to Canada for patients with Lambert-Eaton myasthenic syndrome. We successfully brought that not only to Canada, but then navigated that long pathway that, again, Dr. McMillan covered in his session at the end of yesterday's presentation, not only through Health Canada, but through CDA, through PCPA, and eventually being equitably reimbursed for patients across the country. And that's a journey that we will embark on with all of your support as well with Agamree as we bring vamorolone to Canadian patients, hopefully even more quickly than we were able to do with Firdapse. My last slide, I would say just sort of our focus going forward. You can see our team's recent efforts in celebrating our first Duchenne Muscular Dystrophy Day recently with the team spread out across Canada. The collaborations that Amy mentioned in their US experience are present for our small Canadian company as well. We're active members of Life Sciences Ontario. We're also now members of CORD. And I would hope that with the optimism and the opportunity of the many medicines that were highlighted yesterday that are coming for patients in this particular area, that we can work collaboratively through terrific organizations like Defeat Duchenne to simply advocate as a group for equitable access to all these new novel treatments so that at the end of the day, families and physicians can bring that science to the bedside and make the best possible treatment choice options for the patients that's there with them on that day. And we'll continue to look for partnerships. If there's companies here that don't plan on setting up their presence in Canada, please speak to Kye. We're happy to partner, as we have with Catalyst, to ensure that your innovation, your science, makes it to patients in Canada, and we can work together to do that. So thank you very much.